Hi everyone, it's Bev here, your mental health coach, providing tips, tools, techniques and advice helping you to stay mentally strong in these difficult times and beyond. The topic, post-traumatic stress disorder. This topic is crucial to what's going on in the world right now, and it's so important that I want to present the subject matter over 2 videos to give it the attention that it deserves. In this video, I want to talk about what post-traumatic stress disorder is, how it manifests itself, who is at risk, and just a small bit about what's going on in the brain. The second video will be all about the treatments that are available to you. So, post-traumatic stress disorder. What do you think it is? Well, as the name implies, it is when something happens to a person that is so horrific, so traumatic, that their brain literally blows a fuse. And it's not to be confused with anxiety or panic attacks. So you know that if you suffer anxiety, then you will suffer from trepidations about what's going to happen in the future. But with post-traumatic, it has happened. It absolutely has happened. And that's why it's so difficult to get out of it, because you have the evidence, the data that it has happened. So what are we talking about? What is it that could possibly happen to a person where their brain blows a fuse? Well, it could be rape, assault, burglary, mugging, any kind of abuse where the person feels as if their life's in danger. It could be witnessing or being in a traffic accident. But what about now? What about with this COVID, whereby we have witnessed people dying? We have seen people in great jeopardy. You know, people have lost their businesses. They have lost loved ones. They have been really sick themselves. And we don't know what the future is going to bring. And if you are vulnerable to post-traumatic stress disorder, it will sit on top of all the anxiety, depression, stress that you may be experiencing. And what PTSD does is then give you nightmares, night tremors, hallucinations, and worst upon worst is flashbacks. And that's what distinguishes PTSD from panic attacks and anxiety, the flashbacks. Because when a person experiences the flashbacks, it's as if they've gone back to that moment. They are in the accident. They are being abused. They are being raped. And it is the most horrific, debilitating experience ever. So I'm going to give you some facts around PTSD. So, who can suffer from PTSD? Anybody, but not everybody. So it's really important to take care of yourself. It's crucial to take care of yourself, because post-traumatic stress disorder starts to happen and can occur about 6 weeks after the event and can continue throughout the person's life. Having said that, a lot of PTSDs, if you are resilient, if you're taking care of yourself, can leave you. So the symptoms can disappear. That's the good news. Who do you think, or what is the age group, I should say, that suffers from PTSD? Do you think, is it the middle age or old people or young people? No. This research shows that a baby as young as 1 year old can suffer from PTSD, and that can go on through the life to 99 years of age. Who do you think is more vulnerable, male, female? Well, it's the women. Women are more likely to suffer from PTSD because they're more likely to suffer from domestic violence, and they're more likely to be assaulted or indeed raped. So PTSD, I have to tell you, was not recognized before the 1980s. Before then, it was called shell shock. And lots of soldiers, people coming back from the military, used to be fobbed off by doctors who should know better, telling them that they were lily-livered or weak, for suffering from nightmares or just not being able to readjust to civilian life. 8 million people will suffer or do suffer from PTSD across the globe in any given year. I put it to you that because of what we've experienced through COVID, that number is going to increase. What country do you think suffers the most in PTSD? Is it Afghanistan? Is it Beirut? Is it somewhere in Africa? No. It's Canada. Canada has the highest levels of PTSD. And they looked into that and looked at why is Canada the highest in the world. And they put it down to the fact that Canada has a really cool economy, they don't get into trouble, they have a very good lifestyle. So when something horrific happens, it has a deeper, more profound effect on the victim. So what's going on in the brain for sufferers of PTSD? Well, in your brain, you have your sympathetic system and your parasympathetic system. So what does that mean? In the sympathetic system, you have everything that you need to survive. You have your fight, flight, freeze and shield mechanism. So you see danger, you see a grizzly bear, you run, you fight, you shield, or you freeze, whatever you need to do to survive. And the body is really cool at getting into gear if it suspects danger. The brain does not ask questions, it just does it. And it will release the necessary hormones for combat. The other side is your parasympathetic, and this is where you are calm, you are clear, you are confident, you are at peace. Now, what happens when you witness something awful or you have had to endure something awful? It's as if your brain goes out of kilter. And if your brain is out of kilter, that means your nervous system's out of kilter, everything is out of kilter. And you then tilt towards the sympathetic system. So anything, everything can trigger you at any given time. So it is really important to take care of yourself, because the research says that you may suffer from PTSD, but it doesn't have to last for the duration of your life. It may be just a bout. And they have noted that people that have PTSD and come out of PTSD were people that had lower stress levels, that were taking care of their body, but had a really great support system around them, that were gentle and kind and patient with them, because it's just not a flash in the pan. It can happen for years upon years. And if you're living with someone who's got PTSD, it can have its effect on you. In the next video, I want to talk about all the things that you can do. Some of them are conventional, some of them are non-conventional, and some of them are quite out there. I want to give it all to you so that you have the knowledge to take care of your body. Prevention is better than cure, so let's look at the prevention. In the next video, let's look at some of the cures. But I'm going to leave you with this to tempt your appetite. What do you think smell, your sense of smell, has to do with PTSD? Well, the latest research says that it may be the answer. It may be everything. I'll see you in the next video. Take care. Stay sane.